Many patients swear that the backbone to good health is chiropractic care. I'm working as a chiropractor, and today the question isn't whether this science has a leg to stand on, it's how many. Doctor, your next appointment is here.
The job of a chiropractor is to adjust joints and bones, especially the spine. The theory is they control feeling and movement. If a chiropractor can adjust it, the body will heal itself. Anybody.
If it moves, it needs an adjustment, basically. That's our premise.
Dr. Susanne Langdon of Niagara-on-the-Lake has been making chiropractic adjustments for 17 years.
An adjustment is simply where we have our hands on two sides of a joint and then we adjust into the joint to get it to move properly. Put the joint back in its normal, what we call range of motion.
Of course, in this office, normal is a relative term.
Okay, it's a really busy day. Let's go on.
Oh, yeah, right.
Hi, everybody.
Full waiting. Why has everybody got an animal?
Oh, this is Animal Day today. Today I'm an animal chiropractor.
You can do chiropractic on animals?
Yeah, any animal with a spine.
Really? Yeah. Any animal with a spine?
Any animal with a spine. And your job today is going to be taking histories.
Taking histories?
Uh-huh.
What have you got here?
I have 2 guinea pigs and a cockatiel.
So I guess if it was a duck, then it would be quackery.
Okay, this is Misty.
Misty.
And she's 18 years old.
18 years old?
18 years old.
I'm just trying to do 7 times 18 is... That's 126 years old. Swimming diagonally, you would say, is the problem.
Sort of, yeah.
Does he appear to be in any pain, or?
Nope, not really.
And how about the pigs, the guinea pigs, rather?
They'll squeal whenever you touch it sometimes.
Oh, I see. So squealing when you touch back in.
Yeah.
I do the same thing, actually. do you find that after the adjustment that the dog seems to be in less pain?
A lot better. I can see an improvement.
So you figure if we just kind of give him a little adjustment that he'll be okay?
Yeah.
She has been known to pull a few legs in her time, but Dr. Langdon is serious about the wilder side of her job. In fact, she's co-written the Book of Standards for Animal Chiropractics in Canada.
Now, do you prefer working with people or animals?
I like them both for different reasons. I think that the difference for me is that I get up in the morning and I say, today I can help animals instead of today I can help people.
Dr. Langdon's treatment of Whisper's injured leg means the golden retriever can once again chase a ball.
And the other option was to amputate, so we wanted to try anything but amputation.
Right.
I'm making them feel better so they can have a better life.
So how do you do a fish?
Well, it's a little tricky. You have to do them really fast but really carefully at the same time.
Is this one of the more unusual patients?
It is. It's and you never know what they're going to do. It's the thing about fishes. Because their bones are so little, you can actually feel them moving under your fingers.
No kidding.
Not just squirming, but moving. So I have to be really careful how much pressure I use.
I guess so. And does this actually work?
It does. The first fish I did was actually a little bit crooked. I think it must have had a spinal injury or something. So I was able to adjust it, and it swam pretty straight. So he looks nice and relaxed.
Our next patient is an Angora bunny who was rescued from a petting zoo.
Now, have you worked on rabbits before?
Funnily enough, there isn't a lot of anatomy books for rabbits, so when I was first trying to figure out how to adjust a rabbit, I had to figure out where to find the anatomy of a rabbit, so I couldn't find it anywhere, and the only place I ended up getting was a cookbook.
Wow.
Every time I look at rabbits, I think it's stew. I don't know.
I couldn't help but see the color drain out of your face there. Oh, holy. Full house, or full yard.
So far, we've worked on a variety of patients, but the bulk of Dr. Langdon's animal clients are dogs. Large dogs.
Okay, well, I can see instantly what's wrong with your dog. He was bred with a rhinoceros.
Almost, but this is a girl. We're here to get ready for a dog show.
Part of my job taking histories involves something called
Gait analysis. Do you have any idea what that is?
Yes, that's where I run around with the dog, and you have to look and see whether she's got a hitch in her get along.
A hitch in her get along.
A hitch in her get along.
Hitch in her get along.
Yeah.
Okay.
Yes.
Very nice, Annabelle. Definitely a bit of a hitch in the left rear.
She lost the hitch.
We did a gait analysis, as you asked, Doctor, and it was my analysis. I see a slight hitch in the left flank.
That's usual for Annabelle.
You mean I was right? Uh-huh. Is that a way of saying I was right?
Yeah, that's right.
Well,
we'll give you a treat.
I got a treat right here for myself then.
Dr. Langdon is a somewhat unusual doctor in other respects as well.
We make house calls?
House calls and horse calls.
Our first house call is for Handel, a Maine Coon show cat. Handel is not just a regular client of Dr. Langdon's, he also regularly sees a homeopath.
And do you know what the homeopath is looking at?
She's looking at fear, and he's a crybaby.
I guess that would make him a fraidy cat then, wouldn't it?
Oh, yeah.
I'll make note of that. Doctor, why do we make house calls?
And it's a lot less stressful for the cats, too. They get a little panicky, and it takes them a day or so to recover after they've had a trip like that. So this way, they stay in their environment, and it's much better for them.
Not all Dr. Langdon's clients live in the lap of luxury. Some work for a living.
Pleasure horses, dressage horses, I go to the racetrack and do some of the horses there.
Oh, you do the work? Okay.
Let's take this over and adjust them.
Yeah, we're not putting the horse on this, are we?
No. That's what we stand on.
Oh, no. Okay.
So let's put it at the side and the back of the horse. And when I say 3, I'm going to adjust it, and you just brace yourself. So, okay. So I have to use a bit more force with Dusty than with that Chihuahua.
Yeah.
1, 2, 3. Good boy. Okay.
Did that work?
Let me recheck it.
Seems very quiet through this.
Yeah, they really like it. They appreciate, I think, the fact that somebody's trying to help them and get things moving.
Straightened out.
Yeah.
We've worked our way up to our biggest and last patient of the day. Scotty has a work-related knee injury.
Big knee.
That's a pretty big knee on a pretty big horse.
It's pretty big, yeah.
Okay, well, maybe I'll leave that to you, and I'll just stand over here, well away.
Okay. He seems pretty stable today. So I think he's good to go.
Well, great. I think there's only one way to really tell him. Maybe we should just take him for a spin.
Oh, I think you're right. Round the block. Okay.
Okay.
I really love my job. It doesn't usually feel like a job because I enjoy it so much. It makes me feel good to know I'm helping, whether it's 2-legged or 4-legged. I really love what I do.
I'll be watching the knee very closely. Nice way to end off